South-South volunteer program, WUSC managed to send a delegation to Burkina Faso to learn about HIV prevention strategies and programs that have helped the country reduce HIV prevalence rate from 7% to about 1%.
Primarily, we went there to learn on what innovative approaches are being put in place in Burkina Faso, considering the fact that statistics show that in Burkina Faso they have managed to reduce HIV prevalence estimates from about 7.17 in 1997 to about 1.2%. We thought that such a big reduction in terms of prevalence estimate was a result of some innovative approaches. So we thought maybe as an organization that is actually implementing HIV and AIDS programs in Malawi, we can learn from what our colleagues are doing in Burkina Faso, and probably we can also try to implement the same in Malawi to support the national responses to HIV and AIDS, so that maybe we can also see our prevalence estimates going down, just as the case with Burkina Faso. After our tour in Burkina Faso, we also made an effort to make sure that national stakeholders, especially National AIDS Commission, as well as the Office of the President and Cabinet in the Nutrition and HIV, we had to share with them the key lessons that we have learned, because we know that these are the key leaders in the national response. And we believe that with their support, we should be able to reach out to so many people to share with them those lessons that we learned in Burkina Faso, so that at national level we can also try to integrate those lessons into our national plans in the fight against HIV and AIDS.
Through support from the Canadian Medical Foundation, Devin Pate of Mulanje Mission Hospital volunteered in September to go and learn about palliative care service delivery in Canada.
My trip to Canada, there were several objectives. First was to inform the Canadians how we manage palliative care conditions in Malawi, as well as HIV. And again, on the other hand, to learn how the Canadians deliver their palliative care services, to learn the skills, so that when I come back like this, I should implement them at both at Mulanje Mission Hospital, but as well as linking up with the other cooperating partners like the government, the Palliative Care Association of Malawi, so that we should improve the delivery of palliative care services in Malawi.
Another program by WUSC is the Student Refugee Program, SRP, in which young refugees from Dzaleka refugee camp are provided with an opportunity to get tertiary education in Canada universities. Every year, about 20 students who excel well in their secondary education go to Canada under this program. Josephine Muhaya Nicholas is among 20 students that have started a new lease of life at Canadian universities this year in August.
I heard about WUSC in 2004. So people encouraging me to say, work hard, work hard, work hard. Maybe you make it and then you make it to WUSC. So I had that go in my heart. So when I reached Form 4, I did my Form 4 at Longa Girls Secondary School. And then from there, I got 15 points. And then I was enrolled into the WUSC program. So WUSC has been a helpful program to everyone, not only to me, but also to my parents, those that are remaining. Because when I get there, maybe I'll get educated and then I'll get a good job. I'll be able to support them because there is no other means that can support my parents. So I think it's a hope to everyone, not only to students, but also to parents.
We are really thankful because the WUSC give the chance to my daughter and to continue their studies, and finally they will become at least dependent on her own. Even other refugees who are in the camp waiting for the assistance. It's really impressive and we are really happy for that, and we thank God because God has many ways to help his people.
The 20 young men and women who have gone to Canada this year have brought the number of direct beneficiaries of this program to 130 since it began in 1998. Owing to its strong partnership with the Canadian High Commission, WUSC had been entrusted to administer the Canada Fund for Local Initiative Project since 2006. The program enables Canada to work directly with communities through non-governmental organizations in order to respond directly to local needs. In order to achieve maximum benefit with this fund, WUSC works closely with legally constituted local CBOs and assist them with their projects.
We requested the farmers union to ask for volunteer assistance from WUSC, who provided a volunteer. That was around 2006. And then with that volunteer, we developed that concept of having a warehouse, and the WUSC came into our rescue. We got some funding from Canada, and then built this building. This building costed around 3.5 million. It has helped a lot because, as I said, that one other concept was for us to be processing into the fruits into juice. That has started. We are now in the process of processing that one into juice. That room, which was meant to be a warehouse, part of that room is used as a processing room. So we have our machines installed in that one, and we are doing the processing. It has actually helped us a lot because some of the fruits which were rotting that were rotting that time, this time we are actually processing them into juice. This project which WUSC did with us is very, very good, and we feel like if the partnership continues, a lot can be realized. Because, as I said, that the cold rooms have not yet been installed. If we have a cold room, then a lot of the fruits which are getting spoiled now are going to be preserved, and in so doing, we are going to add on the income of the farmers, because most of the fruits are getting spoiled now.
The Bike for AIDS project is yet another initiative which WUSC has embarked on since 2006. The goal of this project is to ease transport problems faced by people living with HIV and AIDS and mitigate the effects of the pandemic. Under this project, bike ambulances and push bicycles are purchased and donated to community-based organizations carrying out home-based care program, outreach activities, and HIV testing and counseling programs.
As you might be aware, most of our support groups, most of the members that people living with HIV, one of the challenges that they face is that they have to travel very long distances to reach a health center. And one of the critical problems was the issue of transport. So most of people have been failing to take the chronically ill patients to the hospital because of lack of transport, or they've been forced to pay a lot of money to hire like an ambulance or a vehicle to transport their chronically ill patients to the hospital. But with the provision of bike ambulances, this has actually eased the transportation problems for chronically ill patients to be taken to the health centers. And actually this has improved the whole referral system from the home-based care to the health center.
To date, Over 220 bicycles and bicycle ambulances have been distributed to 120 community-based organizations and are proving highly beneficial.
This bike ambulance is helping us to transport patients from villages around this area to our nearest hospital in Likuni. In a week, we transport 3 or more patients to hospital using these bicycle ambulances. When our kids around here get sick and need transport to go to hospital, we also use these bicycles.
Due to the burden the bicycle rendered to the CBOs when servicing and maintenance was due, WUSC rolled out the income-generating activities program, which, apart from providing resources to ensure the longest possible use of the push bicycles and bicycle ambulances, are also meant to provide programming resources for the CBOs. At Inchisi organization, WUSC has helped set up a communications bureau to help the organization become financially self-sufficient.
At first, we had few equipment which limited our services. We could not make enough money. We only had this computer and that printer. We also had this equipment which was not working. With the money WUSC gave us, we have managed to buy other things like a paper cutter, a binder, and this 4-in-1 machine which we use to photocopy, scan, fax, and print documents. At the moment, we are now able to save more people and are making more money. Previously, we could only make less than 1,000 kwacha per day. But after receiving this money from WUSC, we are making more than 2,000 kwacha every day, and per month it is usually over 60,000 kwacha.
After all is said and done, WUSC continues to focus its efforts on harnessing the power of education to change the world. The volunteer program, which has been scaled out, will work towards strengthening partnership between local and international organizations and ensure sustainable capacity building of the grassroots.